Good morning. The world of healthcare is constantly evolving. Today we delve into a concerning trend impacting healthcare professionals across the nation. We're facing tough news that hits close to home for many dedicated individuals. Massive layoffs at Orlando Health have sent shockwaves through the industry. This isn't an isolated incident, it's a symptom of a larger issue affecting hospitals nationwide. This isn't just a headline, it's real people, real families, and real uncertainty. The question on everyone's mind: is my job next? We're here to break down what's happening, why it's happening, and what you can do about it. Understanding the forces at play is the first step toward navigating these turbulent times. We aim to provide you with the insights and tools you need to protect your career and your future. It's not an isolated incident confined to a single location. It's a national trend. Healthcare systems across the country are grappling with similar challenges. Years of financial strain are coming to a head. Rising costs and shrinking revenues are creating a perfect storm. Hospitals are forced to make hard choices. Remember, you're not alone. We're here to empower you with information, providing you with the knowledge and resources you need to make informed decisions. We'll break down the economic factors and warning signs to watch for, and provide practical steps to protect your career. Let's get started. Here's what you need to know. Let's look at the facts, because the reality on the ground is shifting rapidly. We need to understand the forces at play to navigate the changing landscape of healthcare. Orlando Health is laying off hundreds of employees. This isn't just a headline, it represents real people facing uncertainty. These layoffs are mostly concentrated in non-clinical roles, the backbone of any hospital system. These are the people who keep the lights on and the records straight. We're talking about administration, billing departments, and essential support services. These are the unsung heroes who ensure the smooth operation of the hospital. It's a painful but strategic move, a calculated decision made at the highest levels. It's all being done to cut costs amid severe financial pressure. Hospitals are facing unprecedented challenges, and difficult choices must be made. Meanwhile, adding to the turmoil, Rockledge Regional Medical Center is closing entirely. This isn't a restructuring, it's a complete shutdown. This closure is leaving the Space Coast without a key healthcare provider, creating a significant gap in medical services for the community. Access to healthcare is becoming increasingly limited. Every single job at Rockledge is gone, a devastating blow to the local economy and the individuals who dedicated their careers to serving the community. This includes everyone from surgeons with years of experience to the dedicated cafeteria staff who nourished patients and staff alike. No one is spared. This situation is creating a healthcare desert for local residents, forcing them to travel further for essential medical care, or worse, go without. These events aren't isolated incidents. They're interconnected pieces of a larger puzzle. They're symptoms of a system in crisis, a system struggling to adapt to the changing demands and financial realities of modern healthcare. Both hospitals are reacting to the same root causes, the underlying issues that are plaguing healthcare facilities nationwide. These include declining revenues, as patient volumes fluctuate and payment models shift. Low reimbursement rates from insurance companies and government payers are squeezing hospital budgets. And of course, soaring costs for everything from medical supplies to cutting-edge technology. For employees, it means a sudden, stressful job search, often with little warning. They're entering a tough market, where competition for available positions is fierce and the future is uncertain. The emotional toll is real, the anxiety, the fear, the sense of loss. Careers are being upended overnight, leaving dedicated professionals scrambling to find their footing. When major employers like Orlando Health and Rockledge make these moves, it sends shockwaves through the entire industry. It's a wake-up call for everyone in healthcare, a stark reminder that no job is truly secure in this volatile environment. It's time to pay attention to your organization's health, to understand the financial pressures and strategic decisions being made. Start preparing for change, because the only constant in healthcare right now is uncertainty. Proactive planning is essential for navigating these turbulent times. This is a connected story, a reflection of the interconnectedness of the entire healthcare ecosystem. This isn't a one-off event, it's a sign of systemic issues that demand our attention and action. The future of healthcare depends on our ability to adapt and innovate. Why are hospitals in such trouble? One significant piece of the puzzle is Medicaid unwinding. This refers to states reevaluating Medicaid eligibility. During COVID-19, people kept Medicaid coverage even if their circumstances changed. That protection ended in 2023 and states began rechecking eligibility. Over 20 million Americans have lost Medicaid since then. Many lost coverage for paperwork reasons, not true ineligibility. Hospitals now see more uninsured patients, leading to increased strain, leading to a surge in uncompensated care. Previously, Medicaid paid for these visits. Now hospitals often get nothing. Multiply that by thousands of patients, and losses skyrocket. This is a key reason for budget shortfalls. Ironically, these same departments are often targeted for layoffs. It's a vicious cycle, weakening hospitals from within. Medicaid unwinding is a financial earthquake for healthcare. The fallout is hitting every corner of the system, and it's not over yet. Federal policy is making things even harder. The 2024 Healthcare Budget Reconciliation Act changed how hospitals are paid by Medicare and Medicaid. Payment increases haven't kept up with inflation, so hospitals lose money on every Medicare patient. The act also tightened Medicaid eligibility and reduced federal contributions, shifting more costs to states. Fewer people insured means more uncompensated care for hospitals. These changes create a chain reaction: budget cuts, layoffs, and instability. Hospital leaders are forced to make painful choices, with staff reductions often the first step. This is the economic backdrop for the layoffs in Orlando and beyond. Policy decisions in Washington have real consequences on the ground. Orlando's crisis is part of a national trend. Hospitals everywhere, urban and rural, are making deep cuts or closing entirely. The University of Vermont Health Network cut hundreds of jobs. Hazel Hawkins Memorial in California faces closure. Rural hospitals in the Midwest are shutting down entire departments. The end of pandemic relief funding has left many institutions exposed. The business model for American healthcare is fundamentally broken. No hospital is immune. Proactive career planning is essential. The landscape is shifting everywhere, not just in Florida. When hospitals cut costs, non-clinical roles are often first on the chopping block. Administrative and front office, scheduling and billing and support services are especially vulnerable. Technology and outsourcing are replacing many of these jobs. IT and HR departments can also face cuts as projects freeze and hiring slows. If your job isn't directly tied to patient care or revenue, it's at higher risk. Now is the time to assess your role and consider your next move. Think about what unique skills you offer that can't be automated or outsourced. Understanding your risk is the first step to protecting your career. Survival mode means hospitals focus on core clinical operations. Be proactive about your future. Could your hospital be next? Watch for warning signs. Hiring freezes and unfilled positions are major red flags. Delays in supplies, postponed equipment orders, and deferred repairs signal cash flow problems. Cuts to perks and benefits often precede layoffs. Closed-door meetings and vague memos about restructuring are warning signs. An exodus of experienced managers can indicate deeper trouble. Vendors talking about slow payments, that's a serious indicator. Stay alert. These signs give you time to prepare. Early awareness is your best defense. Don't just worry, take action. First, get certified in high-demand medical software like Epic or Cerner. Even basic online training boosts your value. Second, cross-train for roles outside healthcare. Your skills like billing, scheduling, or compliance are valuable in insurance, legal, and tech sectors. Third, update your resume and LinkedIn now. Highlight achievements, not just duties, and use numbers to show your impact. Don't wait for bad news. Be ready. A few hours of upskilling can open new doors. Research industries that value your attention to detail and problem solving. A strong, updated professional presence is your best tool in a competitive market. These steps put you back in control. Start today. Your future self will thank you. The job market is tough, but preparation gives you an edge. Don't underestimate your transferable skills. You have more options than you think. Career pivots are possible and happening every day. A laid-off billing specialist became a fraud analyst at a credit card company, using her skills to spot anomalies. An administrative assistant transitioned to project coordination in tech after learning new software. A clinic receptionist leveraged her customer service skills to lead a corporate support team. These stories prove your healthcare experience is valuable far beyond hospitals. Think creatively about where your skills fit. Highlight your adaptability and problem-solving in your applications. Reinvention is real, and within your reach. Your next chapter could be your best yet. This is a tough time, but it's not the end. Losing a job is hard, but it can also be a new beginning. You've built resilience, adaptability, and problem-solving skills in healthcare, qualities every industry needs. Don't underestimate your value. Be proactive, update your resume, learn new skills, and explore new fields. The people who thrive are those who prepare and adapt. You're not alone. There's a community here to support you. Share your job title in the comments for personalized tips. Join us next time to learn how to spot fake job ads and protect yourself. Remember, you are capable, valuable, and resilient. This is your chance to shape your future. A new dawn is waiting. You've got this. If you found this video helpful, please subscribe, like, and share to support our channel.